Hey everyone, I started this channel with the hopes of changing the focus of progressive attention away from the symptoms of our problems to the root causes. We've witnessed decades of Bernie Sanders fighting fruitlessly for universal health care. We've seen Obama's landmark Affordable Care Act stripped down to bare essentials by the ruthless meat grinder of corporate politics. We've seen wealth inequality skyrocket, all while impotent politicians gut welfare policies and increase taxes on the middle class in a futile attempt to prevent complete collapse. We've seen thoughts and prayers flood the internet and cable news shows every other week each time some new madman massacres children with guns bought at his local convenience store, even though the majority of Americans favor stricter gun control. Why are so many of us screaming for change only to receive empty slogans and lies in return? When progressives like Bernie yell from the bully pulpit about healthcare reform, what are they trying to accomplish? If they're trying to change the minds of politicians, they're fighting a steep uphill battle. Most of the elected officials in power today did not get there through moral fortitude and listening to the needs of their constituents. They got where they are by exploiting a system where the politicians choose their voters, where massive amounts of money from wealthy backers guarantees them victory no matter how slimy they actually are, where voters are routinely forced to choose between a guy they hate and a guy they can barely tolerate. These people have no incentive to listen to Bernie or their constituents because they know that their job is secure regardless. In fact, if they take on the cause of the people, they're more likely to lose their post because their wealthy backers will withdraw their funding. So maybe Bernie is trying to reach the people at large. This is more likely, especially with his oligarchy tour, but almost as fruitless. Even if he is successful at convincing large numbers of people, the politicians have zero incentive to actually listen to them. No amount of angry town halls will convince an elected official to forsake his or her donors and their party elite, because that's where the true power lies in American politics. Politics is one of the most powerful and important activities in a functioning society because, when done correctly, it is both the glue that holds everything together and the lubricant that makes things function efficiently. So let's discuss three things. Let's talk about the role of incentives in political systems and why the erosion of proper incentives leads to oligarchy. Let's go through an example of how the Affordable Care Act was undermined by politicians beholden to the health insurance lobby. Finally, let's talk about how our message should change in order to truly address the issues in front of us today. Incentives in political systems. One of the most important facts about humans is that the primary driver of our behavior is self-interest, especially in a capitalist paradise like the United States. Very few people abandon their lucrative jobs or take pay cuts or willingly give up their possessions. It is fruitless to fight against this instinct. Communism tried to suppress it with disastrous results. Well-regulated capitalism turns this drive into a virtue by rewarding ambition and talent with money and fame while producing massive value for the rest of society. Politics is also guided by this impulse. In autocracies, self-interest cascades down. The dictator at the top is interested in robbing his people and staying in power. In order to do this, the dictator has to keep his oligarchs happy. The oligarchs, in turn, have to keep their lieutenants happy. This wealth trickles down to the soldiers of the regime, who oppress the regular people because they know that it is better to be the oppressor than to join the oppressed. The regular people's self-interest is then trampled and ignored because the threat of crackdowns, imprisonment, and murder is too high to bother rising up. In healthy democracies, the incentive of self-interest flows from the bottom up. Through elections, the people at large control the fate of their public officials. If the politicians fail to keep their electorate happy, their careers come to a swift and abrupt end. Because politicians are interested in continuing their careers, laws and policies drawn up by the elected officials are much more likely to benefit the regular voter. We live in a sick democracy where the flow of this incentive has almost dried up. The two-party system diminishes competition. Politicians simply have to appear slightly better than the other party to get the people's vote. They use vast amounts of money to sway public opinion. On average, roughly 90% of congressional races have been won by the top spending candidate. First past the post voting system entrenches politicians in safe districts from which it is almost impossible to dislodge them. All this skews the incentives of our elected officials. The actual opinions of the voters have a negligible impact on our elected officials. The politicians' only incentive is to reward those who actually put them in power, their party elite, and the wealthy interests that back their campaigns. The self-interest incentive now serves the wealthy and politically savvy instead of the people at large. Over time, these few individuals accumulate so much influence and money that they become oligarchs, the true rulers of the nation. This was happening behind the scenes before 2024, but ever since MAGA ascended the throne, we see it happening explicitly, as Jeff Bezos, Mark Zuckerberg, Tim Cook, Elon Musk, and other billionaires bent the knee at Trump's inauguration. The Affordable Care Act. Idealistic progressive people do run and win elections sometimes, even in a corrupt system such as ours. Many dislike Obama for various actions and decisions of his 2 terms in office. However, the Affordable Care Act started out as a true people-centered reform to our healthcare system. The ACA initially included a public option, a government-run insurance plan to compete with private insurers. This was dropped due to opposition from conservative Democrats, Senator Joe Lieberman, who received over $1 million from the health insurance industry over his career as a senator, and Senator Ben Nelson, whose top donors were health insurance agencies. All Republicans were opposed due to the deterioration in our two-party system. The ACA initially included a nationwide Medicaid expansion to cover more low-income people. This was fiercely opposed by red states. Eventually, the administration compromised, and the states got the ability to run their own exchanges and had more flexibility in enforcing federal rules. The whole idea of red and blue states stems from our voting system and the dominance of the two parties. Eventually, the Supreme Court, long corrupted by a succession of Heritage Foundation work, more on this in my campaign finance video, overturned this provision entirely. The ACA initially had a strong mandate that required large employers to provide insurance. Businesses lobbied hard against this, correctly arguing that it would discourage hiring and increase costs. A universal government-run healthcare plan would not have impacted business in such a way, but the corruption of healthcare industry lobbying has made that plan completely out of reach. The fact that ACA, a moderate bill to begin with, was watered down to almost nothing speaks volumes to the pervasive influence of health insurance in our politics. In the end, the employer mandate was weakened, but in order to keep the health insurance executives nice and happy, an individual mandate was introduced instead. This required individual people to purchase insurance or face tax penalties. This was touted as an economically stable way to ensure premiums did not fall into a rising death spiral by broadening the pool of people paying into the plans. It is no surprise that the profits of health insurance companies jumped by 230% since the passage of the ACA. The ACA cut deals with the PHRMA, the big drug lobby, which agreed to contribute $80 billion over 10 years in rebates, discounts for seniors in Medicare Part D, and other methods. In exchange, Democrats promised no government negotiation of drug prices in Medicare and no reimportation of cheaper drugs from Canada. The main thing that makes medicine cheap for countries that have universal health care is the ability of a major provider representing tens of millions of potential customers to negotiate drug prices. This concession is a huge deal for the pharmaceutical industry and a loss for the American people. The ACA started out as an ambitious reform that aimed to help regular people. In its passage through the meat grinder of our corrupted political process, it turned into the handout for the health insurance industry. The story of the ACA is a testament that no pro-people reforms can make it through a system as thoroughly corrupted as ours. We can try it again and again, and the result will be the same. More money for health insurance executives and more death and bankruptcy for regular people. The problem is not the message. Even with the amount of advertising health insurance pours into propaganda, 46% of Americans prefer a universal government-run healthcare option, and 62% of Americans say it is the responsibility of the government to make sure all Americans have health coverage. If there were laws limiting propaganda, lobbying, and campaign finance, these ratios would grow substantially. If politicians cared about doing what's best for the people instead of parasitic industries that shouldn't even exist, they would pass much more meaningful legislation than what the ACA turned out to be. How should our message change? Progressives stress social programs like universal healthcare and a progressive tax code. Zoran Mamdani ran on a platform of state-owned grocery stores and free public transport. These policies, whether you agree with them or not, do not address the root cause of our issues and stand no chance of getting enacted. Our system is a machine that grinds to dust any policies that benefit the people at large at the expense of wealthy interests. If we put the idea of free public transport into it, we'll get a mandate for everyone to buy gas-powered cars from Ford on the other side. Our message needs to change. We need to stop talking about the quaint notion of taxing the wealthy like that's ever going to happen. We need to start talking about our democratic system at large. We need to push reforms that fix the structure of incentives that our elected officials operate under. Each reform should be aimed squarely at aligning the self-interest of politicians with the self-interest of their constituents and weakening the power of wealthy oligarchs. Public funding for elections, ranked choice voting, multi-member districts, lobbying restrictions, term limits, citizens' assemblies, and other reforms should be front and center in our discussions. Only by fixing the system first can we ever hope to live in a world where people do not routinely go bankrupt from unexpected medical emergencies. A healthy democracy will naturally prioritize the needs of its citizens, not the insatiable greed of the wealthy few.